Thank you for taking the time to watch this video series about what to expect during your baby's hospital stay. In this video series, you will learn about the Colorado Collaborative, composed of healthcare providers who are committed to improving the care you, your infant, and family will receive before and after the birth of your baby. You were asked to watch this video because your baby is at risk for developing neonatal abstinence syndrome, also sometimes referred to as NAS. Neonatal abstinence syndrome is a term used to describe the symptoms a newborn baby may experience because they were exposed to certain substances during the pregnancy. This does not mean a baby is addicted, but rather they may have become physiologically dependent on certain substances they were exposed to before birth. During pregnancy, you and your baby share a blood supply, and almost any drug or substance you take during pregnancy will also be in your baby's blood. That means your baby will share the medications, drugs, and substances you take when you are pregnant. After your baby is born, they are no longer getting the drug they were getting before. When the effects of the drug suddenly stop, your baby may experience symptoms called abstinence symptoms or withdrawal. Babies usually show signs of withdrawal during the first 2 to 7 days after birth. Most babies will show symptoms in the first 48 hours. Not all babies experience withdrawal in the same way, and it is hard to predict exactly what symptoms your baby will experience. Withdrawal symptoms can last days, weeks, or even months. Symptoms of withdrawal include problems with feeding, diarrhea, spitting up, and vomiting, diaper rash, wanting to suck all the time, difficulty sleeping, greater than normal crying or fussiness that can be hard to comfort, muscle tightness or tremors, increased temperature, fast breathing. Your baby may experience some or all of these symptoms during withdrawal. The symptoms may be mild or significant enough to need medication for treatment. Many parents describe the time their baby has withdrawal symptoms as an emotional roller coaster. Common emotions include guilt, helplessness, frustration, and sadness. The hospital staff caring for you and your baby understand this, and they are there to support you and your family through this time and work to get your baby home as soon as possible. One of the ways to do that is give you as much information as we can ahead of time, so you know what to expect during the hospital stay and learn ways you can help your baby. Mothers and families are our first line of treatment for neonatal abstinence symptoms, meaning that interactions with you are the first thing we recommend for your baby. In the upcoming videos, you will learn ways to support and comfort your baby using what we call non-pharmacologic care. Non-pharmacologic care includes many ways you can comfort your baby and help ease their symptoms without using medication. You will also learn how we measure your baby's withdrawal symptoms using a tool called Eat, Sleep, Console. Throughout your baby's hospital stay, your providers will be looking at how well your baby can eat, how much they are able to sleep, and how easy they are to console as a measure of their withdrawal, and to determine if treatment is needed. Another video will talk about breastfeeding your baby. If it is your goal to breastfeed your baby, the hospital staff would like to support you in that goal. But it is not safe for a baby to receive breast milk that has unsafe substances in it. The breastfeeding video will help you and your care team decide if breastfeeding is safe for your baby. Lastly, we want to make sure you and your baby have a successful transition home from the hospital. The final video will describe the safe discharge process that has been created in order to best support you, your baby, and your family. Congratulations on your expected delivery. We hope this video series will be helpful in preparing for your hospital stay.